All right. Can y'all hear me okay?
Can hear you.
Cannot? What about now? All right, perfect. Well, good morning, folks. Thanks, Victor, for the introduction, and thanks to the Beef Reproduction Task Force, for inviting me to come here and talk to you guys, share some of the ongoing research that we're doing with early pregnancy detection. It's funny, I was talking to some of you last night. The last time this meeting was held in person was in Tennessee, I believe. And I was actually attending as a graduate student, like the graduate students presenting posters there. So it's pretty neat to come back, after COVID now and present some of the data that we've been working over the last couple of years. And, today, let me try to make this work here. All right, so over the next 40 minutes or so, I'm going to try to organize my presentation in a way to first provide you an introduction and some of the challenges that we see in the industry with regards to utilization of pregnancy diagnosis. And then as I walk through my slides, I'm going to talk a little bit about some of the currently available strategies. But I know that a lot of the folks that attend the RSBC meeting are probably familiar with most of those. So I make sure I include some of the more recent research that is happening with regards to pregnancy detection in more intensive utilization of reproductive technologies in combination with these pregnancy detection tools. So, the idea of pregnancy or the value of pregnancy diagnosis is pretty straightforward, right? We want to be able to go there and recognize the less productive cows in our herd, identify those non-pregnant cows, and ultimately use that information to make culling decisions, right? Not only make culling decisions from a standpoint, okay, I'm going to cull that cow, but also make some decisions with regards to timing of culling, right? There's a lot of variables that go into marketing cull cows, seasonal variation in cull cow prices and things like that. So as we think about pregnancy diagnosis methods, right, the earlier we can detect pregnancy, the earlier we're going to have that piece of information so we can go out there and make some management decisions. But not only that, for this group, I think it's relevant as we start utilizing more and more reproductive technology in the industry. So we want to know how effective we are being, right? If we are changing a synchronization protocol or evaluating field fertility for a given sire, we can use that pregnancy diagnosis information to actually gauge how our reproductive programs are doing. So, and Vito shares some of that, but even though it's pretty clear that, pregnancy diagnosis is something required from a management standpoint in cow-calf herds, when you look at the rate of adoption in the beef industry, only about 30% of the cow-calf herds in this country are utilizing pregnancy diagnosis on a yearly basis. And what's neat is that whenever we go there and we actually dive into the different methods of pregnancy diagnosis and the percentage of operations that are utilizing them. So here I have rectal palpation, ultrasound, and blood tests. You can see that rectal palpation is the most commonly utilized pregnancy diagnosis method, followed by ultrasound, and then followed by the blood test. But what's neat is that, when you break down, like Victor did earlier, some of those reproductive technologies based on the size of the herd. So here in this figure, you have, let me try to go back here. That data for pregnancy diagnosis for each one of those methods divided based on the size of the herd. So you can see as we increase the size of the herd, so the red bars here represent the smaller size herds, the gray bars are the medium sized herds, so between 50 and 200 head, and the white bars represent the larger operations. As we increase the size of the herds, we increase rate of adoption of technologies, and pregnancy diagnosis is no different, right? So the larger the operations, the more likely they are to be utilizing those. And what's neat is when you compare the same survey from the USDA, that was collected, so they collect that survey every 10 years. So when you look at the data from 2007 compared to the data collected in 2017, you can see that rectal palpation, or at least the percentage of operations that are utilizing rectal palpation didn't change much. But then when we look at the ultrasound or the adoption of ultrasound technology over the last 10 years or so, you can see that increased by about 4 times. And, you know, from what we see in the field, that's probably increasing, continuing to increase. And I couldn't make a comparison for the blood test because whenever they did the survey in 2007, they didn't collect any data with regards to blood tests. But we're seeing an increase in the utilization of blood tests too, particularly, so I'm in Georgia, right? We have a lot of small cow-calf operations. I'm going to talk a little bit about some of those blood tests, but they can really help some of those smaller operations. So from a rectal palpation standpoint, well, we can go there and perform transrectal palpation in our cow herd and sorry, there's a delay here. All right. And perform rectal palpation in our herds, and usually we're limited to going in about 40 days after breeding. We all know someone that is good enough that can probably go a little bit earlier than that, right? But when you compare to some of our other methods, rectal palpation, there's somewhat of a limitation with regards to how early we can go and differentiate those pregnant and non-pregnant cows, right? To perform rectal palpation, of course, you need to be trained and highly skilled. And as I'm presenting you some of these methods, I'm going to put a dollar price there, but you notice that there's a big range there. The reality is, the main drivers of cost in pregnancy diagnosis tools is usually size of the herd and how close you are from a veterinarian, right? The location aspect of your operation. So don't get too caught on the price there. But I'm going to bring the price in for each one of these methods. But one of the things to have in mind about rectal palpation is the fact that we actually can generate shoot side results, right? We go there, you know, palpate a cow, determine whether she's bred or open, we can make a decision right there, right? So from a technique standpoint, well, through rectal palpation, we're going to be looking at asymmetry of the uterine hormones, right? We're going to be trying to feel for that fetus itself, presence of fluid in the uterus, placentums, and all that most folks here are very well familiar with. From an ultrasound standpoint, I think one of the main advantages of conventional ultrasound, or what some will refer to as brightness mode ultrasound, is the fact that we can go in a little bit earlier than rectal palpation, right? If you get someone that it's somewhat well trained with ultrasonography, they can pretty comfortable do a preg check as early as day 25, 26 in a heifer, or day 28 in a postpartum cow where the uterus is a little bit bigger and a little bit harder to scan, right? One of the big advantages of the ultrasound technology is the fact that it gives us some additional information that rectal palpation doesn't, right? We know that whenever we go in within those first 100 days of gestation, we can pretty accurately age those pregnancies, right? And by doing so, we can distinguish pregnancies that are generated from AI, for example, versus pregnancies generated by natural service. But not only that, we're actually able to look at some fetal parameters such as just general fetal morphology or placental morphology, as well as the presence of an adequate fetal heartbeat to try to determine viability of a pregnancy as well. So there's some additional information that we can get with an ultrasound. So this is an example. I don't know if you can see very well, but this is a uterus of a cow on day 30. So you can see from a uterine horn asymmetry, there's not a whole lot of differences there, right? So even though this cow is pregnant, and you can see that there's a CL here on the left side. So she has a pregnancy on the left uterine horn. We cannot really tell some major differences with regards to the size of the uterine horn, right? So if you go there and dissect that tract and remove that conceptus, you can see that there's already a lot of accumulation of fluid in that developing conceptus here. So if you go there and place an ultrasound probe in that uterus and make a cross-section of that uterus, you're going to be able to visualize fluid as well as the presence of a conceptus, right? So most of you are probably familiar with that if you're doing some type of pregnancy diagnosis with ultrasound in your herd. And what's neat about the ultrasound aspect is the fact that, again, we can age those pregnancies very accurately, right? So let's assume we go out there and we're working with a producer, we expose heifer to, let's say, a round of timed AI, and then we wait about 10, 14 days later, we turn a cleaner bull in. And if those heifers are exposed to a 60-day breeding season like this example here, we can come in about 90 days after we bred those heifers to a fixed timed AI and pretty accurately distinguish those pregnancies, right? So we can strategically utilize the ultrasound to distinguish pregnancies. And here's a couple of loops of an ultrasound image of the same actually heifer fetal calf on day 70 and day 91 of gestation. So if you've never seen an ultrasound image before, you're looking at that, you can kind of see the difference in the size of the head, right? So if you think about the field veterinarians are well trained, they can pretty accurately distinguish those pregnancies. So we can use that information to estimate when our heifers are becoming pregnant, but not only that, whether they became pregnant in this example here by fixed time day I. You can do the same thing for embryo transfer and so forth. So from a fetal sexing standpoint, here's a couple of images of a male fetus. So basically the way we sex fetuses is by identifying what we call the genital tuberculum, which is a structure that usually arises in between the hind legs here. If you're talking about a male fetus, that structure is going to migrate from in between the hind legs towards the umbilical cord. Okay. That usually happens a little bit after day 50 of gestation. So we tend to go in to do fetal sexing. Usually we tend to wait at around day 60 of gestation to do it. But basically you can see here a lateral view of that fetus and here a ventral view of that fetus. And you can see that genital tuberculum here. Okay. That's the fetal version of the penis of the fetus. So that eventually is going to develop into the penis, and in the case of a female, is going to develop into the clitoris here. Okay, so you can see here the umbilical cord of the female fetus here, and you can see the genital tuberculum close to the tail of that fetus. And you know, it takes a while for people to learn how to sex, but it's not very hard. You know, once you see a few images, we do a few ultrasound trainings there for veterinarians in Georgia. And, you know, after a day long of training, they get out of there pretty accurate, at least at interpreting the images. So is the transition from rectal palpation to ultrasound and now the blood test, right? So how does the blood test work? Well, with the blood test, we're usually detecting pregnancy-associated glycoproteins. So here I have a layout of a bovine pregnancy that was dissected out. If you go there and you look, here you can see the fetus, you can actually see some button-like structure. So these are the placentomes. If you want to get a placentome like this and chop it off of that reproductive tract and actually cut it in half and put it under a microscope, we're going to see something like this image here on the right, where we have a layer of fetal cells and a layer of maternal cells. And there's actually a subpopulation of those conceptus-derived trophoblast cells that are actually going to differentiate themselves and migrate towards the maternal side. There's a lot of debate on whether, and there's some good information in the poster there about what's happening during early gestation with regards to what that population of cells is exactly doing, what's their role. But regardless of that debate, we do know that those cells, they dump some placental byproducts into the maternal stroma, right? So into the maternal uterus, and some of those proteins or those placental byproducts, they make their way into the maternal circulation. So basically what we can do, we can go there and collect a blood sample, right, and measure systemic concentration of those pregnancy-associated glycoproteins, which again, it's a byproduct of the placenta, right? So if there's a placenta there, there's a pregnancy developing, we can measure that and call that cow pregnant. So when you look at the circulating concentrations of PEGs and their changes during gestation here, you can see that here in a monthly, we're looking at it on a monthly basis. So you can see that as gestation progresses, the concentration of PEGs increases in the circulation of the cow, right? You probably noticed that the concentration of PEGs here in the first 2 months of gestation is really low, right? And this is actually when we're most interested on detecting that from a pregnancy diagnosis standpoint. So if we want to zoom in, notice the difference in scale on the y-axis here. So if we were to zoom in these 2 months here, so the first 60 days of gestation, this is how the PEG profile looks like, okay? Notice we're ranging here from 0 to 12 nanograms, okay, of pregnancy-associated glycoproteins. So you can see that there's an increase, and usually we see a significant difference between pregnant and non-pregnant cows as early as day 24 of gestation. Depending on the study, predominantly heifers maybe a little bit earlier than that. But basically those concentrations of PEGs increase in the circulation, and then as we progress, move forward during gestation, it increases and pick up again. So there's several different commercial blood tests in the market. We in Georgia, you know, I have a predominantly extension appointment, and that's probably one of the main questions that I get there. You know, folks trying to preg check cows themselves. They have little access to a large animal veterinarian in their area, but they do want to know pregnancy status of their cow herd. So they want to learn more about blood tests, and we do several programs across the state. We teach producers how to bleed and how to utilize those tests. But basically, IDEX have a few products in the market, and so does Bioprint and Genex. We get a lot of questions, is there a better pregnancy diagnosis too? The reality is all these have been really well validated, and for commercial purposes, they work really well, right? So they can really accurately provide the information that we need, and I'm going to show you some data regarding the accuracy of those. One of the questions that we get a lot is how early can we detect pregnancy with a blood test? It depends on the test. Usually that's going to range between 28 to 31 days. Depending on the test and the type of animal that you're measuring. So what I tell producers is, well, whenever you're thinking about collecting a blood sample for pregnancy tests, make sure you reach out to the laboratory first, right? And see their recommendations, because depending on the brand of the test that they're utilizing, their recommendation might change slightly. Okay, but you can go pretty much as early as we can go in with an ultrasound and detect pregnancy with somewhat with accurate results. You probably remember that I told you that there's a clear distinction, usually around day 24 of gestation. Maybe some studies show it a little bit earlier than day 24 between pregnant and non-pregnant cows. So you get the question as well, hey, if there's a difference at day 24, can I, just go there, collect a blood sample on day 24? Is it going to work? And the reality is there's quite a lot of data out there to suggest that, if you don't follow the recommendation, you tend to see a decrease in the accuracy of the test. This is one of the studies out of Dr. Poller's group. One of his PhD students looked into collecting blood samples on day 24 and evaluated the accuracy of those. We have some with day 25 with a different assay. So we tend to see a little bit, a small decrease in accuracy that might limit how early we can go. So what I try to tell folks is that, make sure you follow the recommendations, even though we know that we can pick up some of those pegs in circulation a little bit earlier. Those tests were established and really well tested within that range of days of pregnancy, right? So make sure you follow that recommendation, and you should get accurate results. So just to share some of the different research from different groups, accuracy is going to range in a blood-based pregnancy test all the way from 93 to 99%. You're probably asking yourself, why it's not 100%? Well, there's a few reasons why we don't get 100% accuracy in a blood-based pregnancy diagnosis. One of them could be potentially human error, right? If we don't write down the right idea of the cow in the blood tube, well, we cannot get a good an accurate pregnancy diagnosis. But not only that, there are challenges associated with embryonic mortality. And as we talk about Doppler ultrasonography, we're going to talk a little bit about that as well. We know, and Dr. Poller talked a little bit about the high incidence of embryonic mortality in both beef and dairy herds, right? During early gestation, pretty much before we can actually go there and detect a lot of those pregnancies with an ultrasound. So if we go there and collect a blood sample on day 28, and that cow is pregnant at day 28, right? But she loses that pregnancy later on when we go there and, let's say, do an ultrasound on day 35 to compare that blood test to. So that leads to some of a decrease in the accuracy of the blood test. Another reason that drives a decrease in accuracy of blood tests, but not a significant decrease to an extent that we shouldn't be using out there commercially, is the situation, which is rare in the beef industry, where we're breeding cows that are really, really early days, short days postpartum. So if you look at the concentration of those pegs during gestation, you can see that they reach extremely high levels towards the end of gestation. So by the time that cow calves, it takes a while for that cow to clear that circulating pregnancy-associated glycoprotein out of that blood circulation to metabolize those pegs. So if we go there, let's say we breed a cow on day 30 postpartum, which again, it's somewhat rare, not very common in the beef industry, and we go there and collect a blood sample on day 60, we might be picking up some of the pegs that were from the previous gestation. Okay, but the reality is most folks that are utilizing the test, they're collecting that blood sample, that cow, after she's 30 days after she's being bred, cow or heifer, they're going to be past those 70 days threshold in which those circulating concentrations of PEGs go down to an extent that you don't get false positive results. Does that make sense? So there's the potential to have some carryover PEGs from the previous pregnancy that we gotta be aware of, but not very hard to manage. For a long time, one of the main limitations of the blood-based pregnancy test was the fact that we couldn't collect or get a result shoot side, right? So we were limited to collecting a blood sample and sending it to a laboratory, which usually would take about 24 hours to process that sample, 24 to 48 hours, and send back the results for your pregnancy diagnosis, right? So you couldn't make a decision right there. You have to let your cows out and then run cows up again and then sort them out and, you know, take them to the sale barn if they're open. So from a logistics standpoint, that used to be one of the main limitations of the blood-based pregnancy tests. Over the last couple of years, there's been a couple of products out of, I think they're both from Zoetis that came out in the market. IDEX. They're out in the market that you can actually go there and collect a blood sample and process that blood sample shoot side, and in about 20 minutes get a result for that pregnancy diagnosis. So basically the way those tests work, you go there and you buy the kit, and basically the kit will come with a card as well as a reagent tube. You go there and you collect blood samples within a DTA tube, and then you pipette that blood sample into your card, like you have here. It's very similar to an Walgreens human pregnancy test, but instead of urine, we're using blood here. And then after you dispense the blood, you go there, add the reagents, then you wait about 20 minutes and you can make a read. And then, you know, usually you get a result as either a cow is pregnant or open. So in that shoot side test, basically you have a C line and a T line. So C stands for control and T stands for test. If the C line and the T line pops up in the test, even if the T line is a little faded, like the one here on the right, the cow is pregnant. Okay. And if you're in a situation that you have the C line popping up, so your control line is working, but the T line is not there, basically that cow is open. Okay. There are some rare situations in which you're not going to have a C line coming up. So that's the purpose of that line, is the control line. So if you don't get a C line coming up, that means that the test was invalid, so you have got to rerun that sample. Okay. One of the things you keep in mind here is that you need to utilize EDTA tube to collect the blood samples when you utilize this shoot side test. So these are the three main options that we have available, right? So rectal palpation, ultrasound, as well as the blood-based pregnancy test. So as we transition towards some of the potential future directions for pregnancy diagnosis, and the way that I see it, and some people might see it differently, I think there's two main things that we could potentially focus on to generate some information from a pregnancy diagnosis standpoint that would be industry relevant, right? So one of them would be to detect pregnancy earlier than we do, right? So can we go a little bit earlier than we normally do and potentially expose those cows to a second round of AI, right? Utilize some early pregnancy detection methods to more aggressively utilize reproductive technologies. Either we're talking artificial insemination or embryo transfer, right? And another potential use for future, another potential future direction for pregnancy diagnosis is our ability to forecast pregnancy loss, right? Or potentially estimate pregnancy viability as well. So I'm going to show you some data from each one of those and some efforts from different groups here. So this is some data out of Dr. Kai Poller's group. Basically, if you look at that figure here, here we have the circulating concentrations of PEGs. So Kai has done a lot of work trying to utilize pregnancy-associated glycoproteins to estimate pregnancy viability, okay, and potentially predict embryonic mortality. So here you have the concentrations of PEGs on day 30 of gestation, okay. And in this study, basically they go there on day 30 after around the time they eye, scan cows, get a pregnancy diagnosis, collect a blood sample, and they quantify PEGs, okay. Then they run those cows through back again at a final preg check, age those pregnancies, and characterize or identify each one of the cows that lost their pregnancy. And then they separate those cows in two different groups and look at differences in circulating concentrations of PEGs. So in other words, they're asking here, even though those pregnancies are viable on day 30, can we pick up differences in circulating concentrations of PEGs in the cows that are going to eventually experience embryonic mortality? And the reality is, and this seems to be pretty repeatable, okay? When you look at the average circulating concentrations of PEGs, the cows that are experiencing embryonic mortality. So again, we're collecting that blood sample at the same time we're calling them bred with an ultrasound, right? And then we come back later and those cows lost their pregnancy. They're on average, they have lesser concentrations of PEGs in the circulation. And we somewhat replicated that in one of our studies. We see the same thing when we sort our data based on open, late embryonic mortality cows and pregnant cows. You also see a decrease here, right? So those cows they're going to undergo embryonic mortality. They already have lower circulating concentrations of PEGs in their circulation when we're calling them bred. That has been shown in dairy, high-producing dairy cows, and in dairy replacement heifers, beef cows. We've seen that in beef heifers as well. Okay, so that seems to be really, really repeatable, which is quite interesting. But one of the challenges when we look at it is, this is some data from one of my graduate students, Matthew Houghton, where basically we have the circulating concentrations of PEGs for cows that maintain pregnancy, for open cows and late embryonic mortality cows. And each data point here represents a specific cow, right? So when you look at the late embryonic mortality, you can see that red line, that's the average, right? So there's a decrease in the average there, but there's still quite a lot of variation here. So whenever we go there and we look in a stringent estimates of agreement between late embryonic mortality and circulating concentrations of PEGs, we still cannot predict pregnancy loss to an extent that we could, confidently say that that cow is going to undergo embryonic mortality, unless the concentrations of PEGs is extremely low. But there's a lot of variation there still, so there's some room for improvement, at least from a research standpoint, before we can think about some potential applications on forecasting embryonic mortality. Now I'm going to transition and talk a little about some of the future directions in the context of resynchronization, which I think it's more relevant for this group. Because if you think about most of you that are going there and utilizing artificial insemination, that's how we do it in most of our UGA herds. We go there and we expose our cows to a round of synchronization followed by timed AI, right? And about 10 to 14 days later, we'll turn a cleaner bull in. And that bull is going to stay in for the remainder of the breeding season, right? We know, and I believe most of you, preach that when you're out there in the industry working, there's an added value for that AI pregnancy, right? So, and when you look at industry averages, and Dr. Polar shared that, we're talking about an average conception rate of about 50%. So in other words, means that about 50% of our calf crop are still going to be sired by that cleanup bull, right? So could we potentially utilize some alternatives to maximize the number of semen straws or embryos that we're getting into our cow herd and potentially utilize pregnancy detection in combination with resynchronization to maximize that, right? Some of you might probably have done a little bit of that. In Georgia, this is common. Some of them are progressive producers because they're smaller in size, they can't afford to go out there and do heat detection. So they will do one round of synchronization, they'll do a timed AI. Usually around 15 days later, they go there and they put a breeding indicator on, an estrus detection aid. And then for 10 days, they're going to detect heat from day 15 to day 25. Okay. In that situation, fertility in those heifers or cows, when they come back in heat, is great. Right. So you can get, if you get a 50% pregnancy rates, it's not rare to go there and bump the pregnancy rates, overall pregnancy rates to above 70%. If you can afford going out there and do some heat detection, right? Use some good heat detection aids and expose those cows that failed to conceive in that first AI to a second round of AI, you can really boost the number up. But the reality is, most of us, or most of the states, they're utilizing a lot of AI. Cows are generally managed in a more extensive way, right? And we're limited with regards to our ability to detect heat, right? So then we got to think about resynchronization, right? And as we think about resynchronization, you can do something like this here on top. You can go there, expose cows to one round of synchronization, one round of timed AI, and then we come in here day 28, scan cows, And the ones that we recognize as open, we go there, put a semen in, a seeder in, and resynchronize those cows and expose them to a second round of timed AI. Well, that works, but there's some limitations there, right? We talked about yesterday how important Calving distribution is for commercial cow-calf herds, right? So as we think about that interval of about 38 days between timed AI, we're ultimately postponing or increasing average day of conception in our cow herd, right? And whether a seed stock guy that is transferring embryos might be okay with that, some of them might. Most commercial cow-calf herds probably would not be willing to resynchronize because of that large interval. And there's ways to overcome that, right? We can actually go in and expose cows to a round of timed AI and then actually put a seeder in and start resynchronizing them around day 21. We did some work with Justin Reinhardt in Tennessee, actually putting the seeder in and giving GnRH on day 19. Okay. And then 7 days later, you go there and preg check. And that study with Justin, we're actually preg checking on day 26. But here you're preg checking on day 28. Pull that seeder from everybody. Here we don't know the pregnancy status of the cow, right? So everybody gets resynchronized. Whenever it's time to give prostaglandin injection, we go there and only give the prostaglandin injection and expose your timed AI, those females that were actually open, right? So by doing that, we can decrease that interval by about 7 days. But it's still, if you think about your natural service sire, right? We know that the bulk of estrus expressions are going to happen about 19 to 21 days after that round of timed AI. So, you know, the bull's still a little bit ahead of us. So in order to justify doing that, we really have to have an added value in that AI pregnancy or embryo transfer pregnancy to justify. In some situations it does. But, you know, we're still postponing to some extent our day of conception. So one of the things to keep in mind is their limiting ability here to resynchronize females early is how early we can actually go there and detect pregnancy, right? That's not the only one, but that's one of them for sure. When we talk about resynchronizing cows with unknown pregnancy status, there's not a single time that I talk to producers about it and I don't get that question. So I figure I'll bring some data to show that. So does resynchronizing cows with unknown pregnancy status induce embryonic mortality? If we go in at day 28 after AI, do we induce embryonic mortality? And based on, so this is cows that are exposed to timed AI followed by natural service or timed AI followed by resynchronization with unknown pregnancy status. Pregnant and non-pregnant cows were resynchronized here. And you can see when you actually look at final pregnancy rates in the first AI, no differences there. Okay, no differences in pregnancy loss as well. So this is data out of South America. We have data here generated in Tennessee, Kentucky, and Georgia in that same Justin Reinhardt study led by Justin Reinhardt's group. There's also no difference. We're synchronizing cows starting on day 19. Resynchronizing cows on day 19 after AI. Saw no differences in pregnancy rates of the first AI. So it seems like there's not we're going to keep generating more data, but we don't really have a lot of data that suggests otherwise, at least based on our experience. So now I'm going to switch gears and share with you how we can potentially utilize color Doppler ultrasound to try to diagnose that pregnancy a little bit earlier than we would with either the blood-based pregnancy test or the conventional ultrasound. For those of you that have never heard about color Doppler ultrasonography, basically this is it's not that new of a technology. It's been out there in human medicine for a long time. It's somewhat new in veterinary medicine maybe, but basically it's an ultrasound-based technology that allows us to estimate blood perfusion to tissues. Right. So in the situation here, as you think about early pregnancy in cattle, we know that fertilization in cows occur somewhat halfway through that oviduct, right? And usually we have an embryo arriving in a morula stage here, morula tuberosity stage when we're flushing on day 7 embryos, right? Those embryos actually get to the uterus a little bit earlier than that, around day 6, day 5.5 after insemination. But basically what happened with the bovine conceptus is that as we progress in gestation here, from day 5 all the way to day 20, we see some pretty remarkable changes with regards to the morphology of that embryo. So that embryo is going to hatch from the zona pellucida like we have in this electron microscopy figure here. And then that embryo is going to start usually around between 13 to 15, start undergoing what we call elongation or onset of elongation. So that embryo is going to go from a spherical shape in just a few days to a filamentous elongated conceptus like this, okay? After the embryo elongates, it's going to position itself in the uterus and starts undergoing what we call attachment, right? And what's neat is there's a lot of pregnancy loss that happen during that process from onset of elongation to successful pregnancy establishment and attachment to the uterus. And there's folks working on that. But in the context of the Doppler ultrasound, we got to think about the ovary. What we've been proposing, and it's not something that we started, there's a lot of research coming out of South America, really good research looking at this. But basically the idea is, if you think about that early pregnancy, if we have a successful pregnancy, but we look at the cow's ovary, right? I showed you what happened in the uterus. Here's what's happening in the ovary. On day 0, the cow is ovulating. That follicle is going to become a CL, right? And then as we progress in gestation, if we do have a successful elongating conceptus here, that conceptus is going to signal its presence there, and it's going to increase the lifespan of that corpus luteum, right? So that corpus luteum is going to stay there, it's going to keep producing progesterone, that cow is going to, hopefully stay pregnant. But as you think about in a situation where we have pregnancy failure, either through really early pregnancy loss here, some embryonic developmental failure, or if we fail to actually fertilize that oocyte and generate an embryo itself, if you have pregnancy failure early in gestation, what happens is the uterus of a cow is going to produce prostaglandin, right? And prostaglandin is going to break down that corpus luteum. And that corpus luteum, as we have an increase in pulsatile patterns of prostaglandin coming from the uterus of that cow, regresses in size, but not only in size, that corpus luteum regresses in vascularization. So the rationale of the blood, of evaluating blood flow or looking at the CL is, well, can we go there around day 20 and pick up differences in luteal characteristics in distinguished pregnant and non-pregnant cows before we can actually visualize a developing embryo inside the uterus of a cow, right? Can we look at their ovary and get a cue whether she's pregnant or not, so we can start resynchronizing them a little bit earlier? And, as I mentioned earlier, the CL regression process is characterized by both a decrease in CL size, but not only that, a decrease in luteal blood perfusion. And very often, the blood perfusion to the luteal tissue, which is very, very highly vascularized, happens before we have luteal regression. Okay, so that's the rationale for utilizing Doppler. And here we have changes in CL area, CL volume, and blood perfusion of the CL structure based on different days after time day I. And this is work out of Brazil as well, out of Dr. Pugliesi's group. And you can see that here the solid line is a pregnant cow, and the dashed line is the non-pregnant cows. You can see usually around day 20, around day 20 of gestation, you start seeing some distinctive differences between your pregnant and non-pregnant cows with regards to CL area and blood perfusion. And this is how, just so you can see and visualize how a Doppler ultrasound works. So basically, this is a CL image of a cow with a highly vascularized CL. So here on the right, we have a conventional ultrasound image of that CL. And the left side, we have a CL with the Doppler feature switched on. Okay, so everything that you're seeing there, that it's orange and blue and red, these are signals of blood perfusion. Okay, meaning that CL is actively vascularized. So on the other hand here, I have an example of a cow with a low blood perfusion, and I'm not sure if you can see here, but you have a luteal structure that is pretty much the same size as that cow with a highly vascularized CL, but she has very little to no blood perfusion signal right in the middle of that corpus luteum here. Okay, and basically what we've been trying to do is set up a threshold where we can say, well, she has enough decrease in blood perfusion in that CL that we can see that she's undergoing luteolysis. Okay, and based on that, call them pregnant or open. And I'm going to show you some of the studies that we've been doing. But again, this is not something that we try to investigate at first. This is a lot of the efforts were done down in South America. So there's research in both dairy cows as well as Bos indicus cattle. Most of the research in dairy cows show a decreased accuracy when you compare to the beef research. Okay, but when you look and focus here on the beef research, here's the level of accuracy they're having, so above 90%. And what I want to draw your attention here is the fact that if you use a conservative threshold in the color Doppler vascularization, you get what we call 0 false negative results. So if you were resynchronizing those cows and we call that cow open, that cow, there's no chance she's pregnant. Okay, if we follow at least based on their research, there are not a single cow that was actually pregnant. So there's a 0% false negative rate. So you could go there and give her a prostaglandin shot and you wouldn't abort a pregnancy. Okay. So this is some of and what's neat about the Doppler ultrasound in South America specifically is that there has been an uptake in the use of that commercially, right? So veterinarians in the field are actually going there and starting to utilize not only for embryo recipient selection, but also for resynchronization purposes, right? So this is an example of research out of the same group, out of Guilherme Pugliesi's group. And this is just one of the treatments. They had a couple of treatments, but this is just a basic treatment where cows were exposed to a synchronization protocol followed by timed AI. Okay. And this is, you're noticing EB here, ECGs, because they use different products to synchronize, so estradiolbenzoate and ECGs, equine chorionic gonadotropins, which are off-label here for us in the U.S. But basically, they expose cows to a round of AI, and then 12 days after AI, they stick a progesterone device in, and then 8 days later, this is an 8-day-long protocol. They pull the cedar out, do the Doppler scanning, and then if the cow is open, they go there and expose them to a second round of timed AI. So when you look at that, just for simplicity, I didn't bring the other treatment here that had very similar pregnancy rates, but just to show the potential of the technology if we can fine-tune to our production system here. So basically, here's the pregnancy diagnosis with the color Doppler in the red bar. You can see it was 69%. But whenever they go there and actually do the preg check with a conventional ultrasound, around day 60 of gestation, if I remember right, there's only about 57% of them pregnant. So remember, they're seeing about 10% false positive rates. So they're calling cows pregnant here, but there's a false positive rate. Okay. So when you look at the actual timed AI, pregnancy rates, there's 10% decrease here. Then when you go there and you look at the timed AI to the second resynchronization, and this is, we see a lot in resynchronization, is that the conception rates in that second round of timed AI, because our more fertile cows are already pregnant in that first timed AI, we tend to see a decrease in pregnancy rate in that second resynchronization. But it's pretty neat because they went from pretty much 57% of their cows pregnant to AI to about 73%. And those pregnancies were generated at the same time that if they turn a cleaner bull here, from a day of conception within the breeding season at the same time. Okay, so as we think about calving distribution, that's a lot of value there, right? With regards to getting those cows pregnant early. But one of the questions as we start going through the literature is, you know, there's all that data in Bos indicus cattle, right? Can we do the same thing here in our predominantly Bos based population of cows? Because we know there's subspecies differences with regards to both embryonic mortality, okay, as well as CL morphometries, right? So there's data that suggests that there, and Kai presented some of that yesterday, that there are differences in embryonic mortality. But when you look at temporal changes in that CL structure during luteolysis, there's some data that might suggest that that luteal regression process happens quicker in Bos indicus cattle. So we didn't really know if in our beef population we can utilize the same type of technology to recognize cows pregnant around day 20 of gestation. So over the last couple of years, we probably enrolled close to 400 head, about 350 head in this experimental design here, where we expose cows and heifers to one round of timed AI. And then we came in here day 20 and 22, because we want to figure out if there was some major differences between 20 and 22. And we collected videos of the ovary of those heifers in cows and evaluated their luteal blood perfusion. Basically, we set up a threshold of 30%. So if there was a 30% of less area of that CL with blood perfusion signal, or if that CL was not present, of course, or smaller than 2 centimeters, we call that cow or heifer open. Okay, and we did all that retrospectively, just looking at the ultrasound image. We're not looking at the heifer, we're not looking at the cow. We collect the video, sit in front of a computer, and assign pregnancy status. Okay, of course, if you're doing the field, if this, if you can show that we can utilize this in the future, this is something that can be done in about 5 seconds if someone is good at picking up ovaries. So it's a fast approach to diagnose pregnancy. So jumping into the data, we look at our data. This is actually cows. It says replacement heifers, but this is the data in cows. The accuracy was 87% with about a 12% false positive rate on day 20. When we moved to day 22, we were in our accuracy of 92% and 8% false positive rates. When I draw your attention here, 0% false negatives. So if you were resynchronizing any of these females and we're giving a prostaglandin shot, we wouldn't abort any pregnancies, right? If you go there and look at the data in heifers, we did the study in heifers later. We might have gotten a little bit better at the technique ourselves, or maybe there might be some just intrinsic differences in heifers, which doesn't necessarily follow the same pattern they see in Brazil. They see a little bit more false positive in heifers, replacement heifers in Brazil than we saw here. But basically, in heifers, we were about 91% accuracy. Okay, so with an only 9% false positive results on day 20, when you go at day 22, only a 6% false positive results. And again, no false negative results, meaning that if we were resynchronizing these females and we go in there and give a prostaglandin shot, we wouldn't abort any pregnancies. So some of the ongoing research, unfortunately, we don't have enough data to show you guys, but we're starting to utilize this. We're exposing cows to 1 round of timed AI, working together with Vitor, trying to generate a field fertility data of cows exposed to that resynchronization in timed AI with the Doppler on day 20 here, okay? One of the challenges that we foresee here, we think that some of those cows might develop a persistent follicle here. But we're not sure. We really have to generate the fertility data in order to make proper recommendations, which we're just not there yet. What we can see here is, what I can tell you is that we can, in fact, accurately detect those, the majority or recognize the majority of non-pregnant cows around day 20 of gestation. So some of the other ongoing research that we're doing is with regards to trying to understand why we have some false positive results, right? Are these just cows that naturally have an increased luteal lifespan, or are these cows that are actually pregnant whenever we're scanning them? But by the time we go there day 30 and we preg check them to see how accurate we are with the Doppler, they're undergoing pregnancy loss, which I believe it's a little bit of both. So we're going to try to dissect that out in the next year or so and hopefully generate some interesting data there too. And just to wrap everything up, we have different alternatives that you utilize currently available: rectal palpation, ultrasound, and blood test. And one of the things that Kai says a lot is, there's not a one-size-fits-all when it comes to pregnancy diagnosis, and I second that. Mainly after, spending a lot of time going to county meetings in Georgia and traveling around the state, in extension efforts, working with smaller producers, there's a lot of variation with regards to what kind of pregnancy diagnosis better fit a given operation. So ultimately, I think as an industry, we have to understand those, the pros and cons of each method, and then make our recommendations based on that. Regardless of that, always work with your veterinarian, of course. We also have the opportunity to potentially utilize pregnancy diagnosis early in the context of resynchronization. And hopefully in the next, 2 to 5 years, we're going to make more progress with regards to both predicting embryonic mortality as well as potentially developing some more intensive resynchronization systems that we can maximize the proportion of pregnancies that are generated either through AI or embryo transfer programs. So with that, I'm probably running out of time. Just want to thank everybody that was involved in this efforts here, and the data that we generated was supported by the Angus Foundation with a Doppler study. So we're going to for sure acknowledge them and turn it over to you, Vitor. If we have time for questions, I'll be happy to entertain any.
Let's give Pedro a hand. Have time for a couple questions.
Yes, sir.
These things program that you have there, you see your Dave. Project, give them shots for all the network. See her 8 days later, I guess.
Yes. So the question is, what about the resynchronization where we're preg checking them on day 20, right? Can we utilize that? We're doing timed AI. Can we utilize that in recipients? I think there's probably a better application for recipients than timed AI. A couple of reasons. Well, there's the added value of the pregnancy there, and you know, folks are more willing to run cows through a few more times. But not only that, in a recipient setting, we completely eliminate the oocyte component, right? Because one of the things that we don't know is whether we are or not going to develop some persistent follicles in those resynchronization programs, because we cannot give a gene age up front, because otherwise we'll form a CL, and then we might harm our ability to detect pregnancy on day 20, right? That's why those protocols are working in Brazil, because they use estradiol-based products. So they can use estradiol to set the new follicular wave. We can't. So we just got to put a seeder in, and hopefully that will synchronize them enough to generate some good fertility. But we might have some persistent follicles there, which in the situation of a recipient cow, we completely eliminate that. So yes, we're looking to generating that data in recipient cows as well. Not only from a pregnancy diagnosis standpoint, but from a recipient selection too. So we have a trial happening right now where we're scanning cows with a Doppler, or at least trying to recruit cows to scan cows with the Doppler to dissect out if we can use the Doppler to better select recipient cows. Because again, that same group did work in Brazil suggesting that there are some differences in luteal blood perfusion in recipients that become pregnant versus the ones that don't. So there's a lot of potential. We need to generate the data first, but there's a lot of potential for utilizing embryo transfer programs, Doppler technology. Any more questions, guys?
So we showed data on bags when pregnant and return mortality. So what system do you use for that?
So the question was, well, there was differences in PEGs in late embryonic mortality cows versus the ones that didn't, right? So what system did we utilize to quantify those PEGs? Both studies that I showed you here were with an in-house assay. So these are antibodies. So those PEG assays, they're all antibody-based, right? We use antibodies that detect PEG. Those assays, particularly, they were all in-house assays from Texas A&M. There are studies with commercial assays that show the same thing too. Okay. The difference between assays is, you know, when you think about those PEGs, we have probably a little bit more than 24 pregnancy-associated glycoproteins, and depending on the antibody, they're going to be detecting a different array of PEGs. Some antibodies will detect PEG X, the other antibody is going to detect PEG Y. You know, so yeah, there's some differences between tests, and this test is an in-house test.
All right, let's thank Pedro one more time.
Thank you, Victor.
Our next speaker, if you want to give Jeremy the microphone, please.
That's what I'm looking.
No, I think that, yeah, give him. So our next speaker on the same topic of more advanced reproductive technologies is Dr. Jeremy Block from University of Wyoming, speak on IVF and ET and what to expect when implementing those technologies and considerations for success. So, Dr. Block. Appreciate it, guys.
now. Thank you. So what I'm going to focus on is really the basics of how embryos can be produced and some of the main factors that affect the production of embryos for embryo transfer. And then I'll also talk about some just general things to consider if you're thinking about implementing an embryo transfer program. So I think it's important to start with some context. So the idea of embryo transfer is actually a pretty old one. So embryo transfer was first accomplished more than 140 years ago when Walter Heap successfully transferred embryos from one rabbit strain to another rabbit strain and had successful birth of live offspring. Of course, the application of this technology in livestock species took several more decades before it actually came about. So if we look at cattle, for example, the first successful birth of a calf derived from embryo transfer was not published until the early 1950s. And then the actual application of embryo transfer as a commercial technology wasn't applied until the early 1970s. All of this in the early days was done both on the embryo recovery and the embryo transfer side of things using surgical procedures. Of course, over the last 40 plus years, there's been many advancements, both in the procedures that are used and the protocols that are applied for these technologies. So why would you consider even using embryo transfer in a beef cattle operation? So there's several different advantages to the use of embryo transfer. One of the ones that's primarily looked at is that use of embryo transfer technologies is an efficient way to multiply the offspring from elite genetics, both on the male and the female side. In particular, this ability to select for both the male and the female leads to an enhanced rate of genetic gain. So if you look at this equation here on the right-hand side, it's basically the equation that goes into calculating the rate of genetic gain. And there's two components of that equation that embryo technologies can affect. One of the main ones is selection intensity. So what does that mean? Well, if you're doing natural service in your herd, you can determine what bulls you're going to use for natural service, but all of the cows in your herd are going to get bred by a bull. The same is the case for AI. You can choose which bulls you're going to use for AI, but all of them are going to get AI. When you do embryo transfer and you have a herd of 100 cows, you're going to go into that herd and you're going to say, I'm only going to select 5 of these cows to produce embryos from. So now I have significantly impact the selection intensity on the female side of the equation. The other area where we have an impact is generation interval, which is the denominator on this particular equation. And that's something that's come about more recently with the advent of in vitro embryo production technologies, where we can not only collect from donor animals that are already pregnant, but we can also collect from females that haven't reached puberty. So you can essentially produce live offspring from an animal that isn't capable of producing offspring naturally by herself. So one thing that fits within the beef production industry is, particularly on the commercial side, a lot of crossbreeding is involved. And the question is always, what do you do with the F1? What should the F1 get bred to? Well, with embryo transfer, you can theoretically just always produce F1. So you always have the advantage of heterosis from the F1, but you're not worried about what you have to breed the F1 offspring back to. And then lastly, really from a seed stock producer point of view, embryo transfer and the freezing of embryos that are produced from elite donors and males is a much more efficient way to export genetics to other countries as compared to transporting live animals. So despite all of these advantages, and this was touched on in Vitor's talk yesterday at the beginning of the session, we don't see widespread application of many assisted reproductive technologies among beef producers in the United States. But certainly if we look specifically at embryo transfer, in the most recent USDA survey, which has been referenced a lot during this meeting, 3% of beef cattle operations in the United States reported using embryo transfer. It doesn't break it down in terms of just transferring embryos, producing embryos, whatever the case. But regardless of the aspect of embryo transfer, a really small number of beef operations in the US reported utilization of embryo transfer. So there's obviously many reasons why this may be the case. One of the biggest drivers is costs associated with producing embryos. Another big driver is there's a lot of moving parts to the process of implementing an embryo transfer program. And so what I kind of hope to do today is apply some of the basics of how do you produce embryos, what are the main things that can affect the production of embryos, and so that maybe some of those things that are part of the steep learning curve associated with implementation of embryo transfer are a little bit more clear. So let's first talk about methods for embryo production. So the traditional method is a method that's called superovulation and embryo recovery, sometimes referred to as conventional embryo transfer. This is a method that was developed way back in the early days when embryo transfer was first being applied in cattle. Over the course of the last 40 years, a lot has been learned about the physiology of the cow that has made improvements in the protocols that we use to perform superovulation. And so on this particular figure, I have a protocol that's been developed that's pretty effective in Bos Taurus influenced animals. But the point I want to make is just basically what are the components of a superovulation protocol? So all of the protocols today kind of have the same basic 5 components that need to be addressed. And because of developments in understanding how follicular waves occur in cattle and how we can control or synchronize follicular waves, we basically achieved a point where all superovulation protocols can be performed at a self-appointed time. So in the early days of embryo transfer, before we understood how follicular waves worked, the common approach was we need to have a reference heat on this animal. After that animal comes into heat, we can start giving FSH 8 to 12 days later. Those types of protocols can still be applied, although they're less effective than protocols that take advantage of synchronization of a new follicular wave prior to the administration of FSH. So let's kind of walk through these steps. The first step is that we need to do something to synchronize the emergence of a new follicle wave. The importance of this is that stimulating a cow at a random stage of the estrous cycle where she may have a dominant follicle will have a negative influence on how well she's going to stimulate. Additionally, when we synchronize the emergence of a new wave and time the administration of FSH with the emergence of that new wave, we get an increase in endogenous FSH within the animal to be timed with administration of exogenous FSH. So we kind of get a boost in the amount of FSH. So in this particular protocol, the way that we're synchronizing emergence of a new follicular wave is a seeder is inserted to hold any large follicle on the ovary so that it doesn't turn over. 2 days later, an administration of GnRH is given to induce ovulation. The animal responds to that. She should have a new emergence of a follicular wave 36 to 48 hours later. When that occurs, we want to time it with our regimen of exogenous FSH or follicle stimulating hormone. So for superovulation, we have to give exogenous FSH because follicles have to grow large enough to reach a size where they can be induced to ovulate. During the normal estrous cycle, as most of you are aware, a cow is only going to ovulate or grow 1 follicle big enough to ovulate 1 egg. So in order for embryo transfer to be effective, we need to manipulate the cow's estrous cycle so that she produces more than a single embryo. So exogenous FSH is administered starting with the emergence of a new follicle wave. Typically, these regimens are going to consist of 8 injections of FSH given twice a day over a 4-day period at 12-hour intervals. The need for this is that the half-life of FSH is very short, so it only lasts 5 to 6 hours. And in order to induce superovulation, we have to maintain levels of FSH in the blood at a certain level over a course of 4 days in order to induce superovulation to occur. So it's a very intensive process, obviously, to do superovulation because of that need and how FSH is administered. When we get to the end of that FSH dosing regimen, the next thing that we need to do is we have to induce the animal to come into heat. So the last step in that process is to administer prostaglandin F2 alpha, which, as Pedro was explaining before, is a hormone that causes lysis of the corpus luteum and then allows a cow to come into estrus. The animal will be detected in estrus, and then with superovulation, because we're hopefully inducing multiple follicles to ovulate instead of just one, we have a wider range of when ovulation is going to occur. So in superovulation, we're going to perform insemination at least 2 times after detected estrus, in some cases 3, to make sure that we cover and have semen available in the reproductive tract to cover all of those ovulations that are going to be occurring. Then 6 to 8 days later, after the animal has been in heat, we can perform the embryo recovery procedure, which since the late 1970s, early 1980s, was transitioned into a non-surgical procedure that utilizes a gravity flow to allow fluid to go into the uterus and then come out of the uterus into a collection device that can then be searched on a microscope to find and grade and manipulate embryos that are recovered. So that's the conventional method of ET, and that's basically how it works. There's variations to this. Different people will use different dosages of FSH, but kind of those same 5 steps are pretty consistent across all protocols. So moving into a newer method of embryo production, which has been around commercially since the early 1990s, but as you'll see in a few slides, has really only been applied readily in the last 10 years or so, is what is termed ovum pickup and in vitro fertilization. So as was mentioned in the beef on dairy talk yesterday afternoon, it's also possible to produce embryos by in vitro fertilization using oocytes that are collected from slaughterhouse-derived ovaries. But of course, that's not the most common procedure that's used, particularly if your point of doing embryo transfer or embryo production is to generate embryos from the most elite animals. So when we do OPU IVF, the first step in the process is that we have to be able to harvest the oocytes that are the starting material for the process. The way that this is done in cattle is by performing a procedure that's called ultrasound-guided transvaginal ovum pickup. On the far left image, you can see kind of the setup that this particular veterinarian is using. Basically use an ultrasound probe that can be inserted into the vagina to visualize the ovaries. It has a needle guide that allows you, once you have the follicles in line with the needle, can be punctured through the vaginal wall, and the fluid that is contained within these follicles can be aspirated out, and hopefully within that fluid that you're recovering, you recover an oocyte as well. So the process of OPU IVF consists of 4 basic steps. The first step is to collect the oocyte, as I just mentioned, using the OPU procedure. When we harvest oocytes for OPU, they're immature oocytes. So at this point, they're not ready to be fertilized. The first step that they must undergo is a process that's called in vitro maturation. So after oocytes have been recovered, they're placed into media that promotes their maturation. This step lasts for about 24 hours. For those of you that are familiar with kind of how the IVF business operates in the US, a lot of times this process is done in transit, either through transportation on the road or through shipping incubators with FedEx or UPS. Because labs are kind of not like located all over the US, so oocytes have to get from where they're being collected to an IVF lab. So it's not uncommon that that occurs during transport. Once oocytes have matured, they're now ready to be fertilized. This process will happen in an IVF lab. Essentially, all that happens is you take semen from your desired bull, put it in a petri dish with the oocytes that have been collected, and let them incubate together for somewhere between 8 to 20 hours. After that process is over, you hopefully have oocytes that have been fertilized. You place them into culture media for the next 6 to 7 days, and then you determine how many of those oocytes have developed into a transferable embryo. So this slide kind of just gives you some context about what is the utilization of embryo transfer and the two different production methods within the United States ET industry. So this data is from 2020. It basically shows the number of transfers that were performed in the US. This is reported by ET practitioners to the American Embryo Transfer Association. I have both on the slide what has occurred in the dairy industry alongside, and that's in the red lines and red dotted line, versus what has occurred in the beef industry, blue line and blue dotted line, over the last 10 years between 2011 and 2020. So the main thing that I like to point out here is, regardless of whether you look at beef or dairy numbers, the number of IVF embryos being transferred in the US has increased significantly over the last decade. Of course, the uptake of that technology in the dairy industry really spiked about 2017. But in the beef industry, if you look at the solid line, these are the number of beef IVF produced embryos that have been transferred over that time period. And when we reach 2020, the number of embryos produced by IVF that were transferred versus those that were produced by conventional ET are actually even. And it's likely that when we see the next report, IVF will pull slightly ahead. So there's been more of a gradual trend in the beef industry, but regardless of the industry, if you combine that data, significant increase in the use of in vitro embryo transfer in both dairy and beef. So I think it's helpful to kind of compare and contrast certain parameters related to each of these production methods. So I'll just kind of go down the left-hand side here. So one thing that's important, particularly for the efficiency of embryo production, how often can I collect a donor with each of these two procedures? Well, with superovulation, you can collect about every 4 to 6 weeks. The issue with that is that in most cases, you're probably not going to collect at that frequency more than 3 consecutive times without needing to give the donor a rest from being superovulated that many successive times. So you can do it every 4 to 6 weeks if you want to be aggressive, but there's going to be a limit to how many times you can get away with doing that. OPU IVF, on the other hand, we can do every 2 weeks. We can actually do it even more frequent than that, but in commercial context, it's pretty much applied that we'll collect donors every 2 weeks. What about FSH? So FSH is a big issue because it's very expensive. As I mentioned in the superovulation slide, it takes a lot of shots and a lot of time to be able to elevate the FSH for the desired amount of time. So superovulation, we can't perform superovulation without administering FSH. But for OPU IVF, it's not a requirement that donors get FSH. Now, we can talk later, we will, whether or not it should still be given, but you don't have to give FSH to produce embryos using the IVF procedure. What about some more context on the donors? So can you perform the procedure on prepubertal or pregnant donors? Of course, in the case of superovulation, that is not possible. Animals need to be cycling to be able to superovulate. And because we're recovering the embryos from the uterus of the animal, that animal can't already have a pregnancy going on inside of the uterus at the same time. On the other hand, we can have both of those types of donors with OPU IVF. And the reason for that is because we're taking the oocyte out of the ovary and then manipulating it in vitro. So even if it's a prepubertal animal, we can do things in vitro to condition that oocyte to hopefully still have the capacity to become an embryo in the lab. We can do pregnant donors because the procedure of ovum pickup doesn't have anything to do with the uterus. So all that is manipulated is the ovaries of the animal to be able to aspirate the follicles off the ovary. So a pregnancy can be going on in the uterus and not be impacted by any of the procedure that's involved in OPU. And there's some variability between donors, but typically we can perform that procedure at least up to 100 days of pregnancy, and in some cases up to 100 or 120 or 130 days of pregnancy. Another important aspect is utilization or effective utilization of semen. So if we look at superovulation, I already mentioned in the previous slide where we went through what's involved in superovulation. We're going to have to inseminate the cows at least 2 times, sometimes 3 times. And depending on what kind of semen type we have, conventional or sex semen, we might need to use multiple straws of semen at each one of those insemination time points. So typically for superovulation, we're going to be looking at using 2 to 4 straws per each donor animal. If you compare that to IVF, we can really use semen a lot more effectively in the IVF condition because we don't need a lot of sperm because we're putting the sperm right next to where the eggs are in the petri dish. It doesn't have to swim through the uterus and into the oviduct to find the oocytes. So 1 to 2 straws, depending on what kind of semen you're using, can be enough to fertilize the oocytes from multiple donors, not just a single donor. So effectiveness of the utilization of semen is a big advantage for OPU IVF compared to superovulation. What about if we look at viable embryos produced per donor per procedure? Well, actually, as we'll see in the next couple of slides, these 2 procedures are pretty comparable. So in most cases, if you have a donor that doesn't have any kind of reproductive issue, and you submit her to a superovulation protocol versus an OPU IVF protocol, you wouldn't expect there to be drastic differences in the response of that donor. So there's really no advantage between either of the 2 procedures and how many embryos you're going to generate, regardless of whether it's superovulation or OPU IVF. So what about costs? So costs on this particular table come with lots of caveats because there's lots of things that go into determining what the cost is. And these estimates don't really take into account the cost of semen or the cost of labor. It's really more what does it cost if you're paying an ET practitioner to perform the procedures or an IVF lab to perform the procedures. If you're giving FSH for superovulation, then that cost is included. So the range, because of all these caveats, is quite high. There's not drastic differences between the 2, but generally speaking, IVF is going to be slightly more expensive in most cases, because if you compare the 2 procedures, in superovulation, the cow is doing all of the work, then an ET practitioner is coming on the day of recovery, flushing out whatever that cow produced. For IVF, the donor cow is literally an egg donor, and then people in a lab are having to create the embryo from that egg, and those people have to get paid. So it's more expensive because of that extra process and extra labor that's involved. But it's not drastically expensive, and whether or not it's more expensive compared to superovulation will depend on a number of things, including how prolific the donor animal is. What about pregnancy and calving rates? So still, even though we've made a lot of progress in what's involved in culturing embryos in vitro and producing embryos in vitro, overall, the superovulated embryo will still tend to lead to increased, particularly calving rates and also probably pregnancy rates compared to OPU IVF. But these differences are not dramatic. It's not like we're saying 70% for superovulation and 40% for IVF. They're within a reasonable range. But overall, the superovulated embryo is still a more hardy embryo that's more resistant to stress and freezing and those kind of things than an IVF embryo. And because of that, you would expect in most cases that pregnancy and calving rates are going to be slightly higher for those kinds of embryos. So one of the things that I was asked to discuss is what should people expect if they're doing embryo transfer? So here again, I'm taking data from the American Embryo Transfer Association for the year 2020. So this is data that's reported by ET practitioners to the society. On the top, I have numbers for superovulation. On the bottom, I have numbers for OPU-IVF. So what are we mainly looking at here? Number of viable embryos. If we look at superovulation, and these are just beef donors, no dairy animals in these numbers. The average number of viable embryos or transferable embryos produced per superovulation procedure in 2020 in the US was 6.8 for superovulation. So because FSH use is not required for OPU-IVF, and some people use it, some people don't, what the AETA has done is break out that data so that we kind of have three sets here. Donors that were set up with some stimulation with FSH, or without FSH, and then the total combined. If we look at the total combined between those two different sets, the average number of viable embryos produced by OPU-IVF was 6.6 in 2020. There is some numeric advantage within this data for donors that were set up with some version of FSH stimulation. I would caution using this as a comparison because it's not an experimental data set. It's just survey data that's being reported. But in this particular year of this data, there was numeric benefit for donors that received some version of FSH stimulation. So the one context that that data does not provide, it gives you an average, but it doesn't give you the whole story. And the issue with both of these procedures is that we have very high inter-individual animal variation. So if I have 10 animals lined up that I'm going to do conventional flushing or OPU-IVF, I'm going to have drastic variation. It's going to be a bell-shaped curve, but the difference between what's on the low end and what's on the high end is going to be potentially a pretty big number. So if you take the data from the previous slide, we're getting around 6 to 7 viable embryos per procedure. But what's the range? Well, the range can go from 0 to more than 50 viable embryos in a single procedure. So if the high end of my range is close to 50, but my average is close to 6 or 7, what does that tell you? There's a lot of procedures that are ending up in numbers that are less than 6 or 7, and a lot of those are zeros. So if you want my honest opinion about what your realistic expectations should be if you're looking to get into the embryo transfer business, you should expect to see a lot of zeros and a lot of 2 or lesses, because we're pushing the limits of what biology can do. We have a lot of moving parts, so Murphy's Law always gets involved. Now, that's not to say that there aren't things that you can do to reduce the incidence of a 0 or a 1 or a 2, or increase your probability of getting a number that's higher than 6 or 7. But the reality is that this doesn't work all of the time. And if you go into it expecting that, hey, my buddy down the road said he got 25 embryos when he flushed his cow, and I expect to get the same. No, I did, till you flushed the cow. But odds are you're probably not going to get 25 embryos, so I wouldn't be planning on that. So some data from Dr. Looney, that's superovulation data from way back in the day, but it's still applicable, kind of gets to this point. So in a flush data set, he found that 30% of the animals that were donors produced 70% of the embryos. Why is that? Because we have this huge discrepancy in how prolific animals are going to be when submitted to either of these protocols. So the more prolific donors are going to produce a much higher percentage of the viable embryos than the less prolific donors. The good news is that within individual donor animals, we see that there's fairly high repeatability. That means if you have a donor that's prolific, likely she's going to be pretty prolific every time that you do her. On the inverse of that, if you have a donor that's not prolific, it's pretty likely that she's going to be not prolific every time that you do her. So there's an opportunity here that in a lot of cases isn't really taken advantage of for selection of donors that are prolific. And I'll talk a little bit more about how we can kind of select for that in a couple of slides. So let's talk a little bit now about on the pregnancy side. We talked about embryo production side of things, but of course, if you're in the embryo transfer business, you're wanting to generate pregnancies and live offspring presumably as well. And so it can't be overstated how dependent pregnancy rates are on the pool of recipients that are being used to put embryos in. If we look at pregnancy per ET, so that's how we're going to define how we measure the success of embryo transfer is, if I put in 100 embryos, what percentage of those resulted in a pregnancy? So I'm giving you a pretty broad range because, as with everything that I'm discussing, there's huge caveats and dependent on different variables. But you can expect that probably this is a good 90% confidence interval for pregnancy per ET, meaning that 90% of the expected observations for pregnancy per ET would fall within this range, and it's going to be between 40% and 70%. So what's the big driver of that variation in numbers? It's how good are you doing on the recipient side of things? There's a lot of focus on producing embryos and talking about quality of embryos, but the pregnancy rates are really driven in large part by how you're managing and selecting recipients. That's not to say that embryo production method cannot have an impact. We already talked a little bit that superovulated embryos, generally speaking, are probably going to give slightly better pregnancy per ET and calving rates. But the difference in this between IVF and superovulated embryos these days is much more narrow than it was 10 to 15 years ago, because there have been improvements in the process of IVF to make better embryos. And then you also have to take into consideration are using fresh embryos, which are typically going to result in better pregnancies, particularly for superovulated embryos, versus embryos that have been frozen. So what are some things that affect embryo production? Well, unfortunately, there's a lot of things that affect embryo production, and that's one of the reasons that there's a lot of variability in how animals respond to either of these two processes. So I'm going to try to touch on some of these in the next few slides. So I'm going to start by talking about breed/genetics, and what I'm really talking about for this particular talk when I talk about breed is Bos indicus versus Bos taurus. And I'm going to try to hit on why we're seeing an increase in the use of IVF embryos compared to superovulation, particularly among Bos indicus donors. So most of you that have Bos indicus animals understand that there's several physiological differences between a Bos indicus cow and a Bos taurus. Some of these differences make it better to use IVF than superovulation, for example. Some of them are kind of a wash. So let's look at a few of them. So one of the differences between Bos indicus and Bos taurus is that they're more sensitive to gonadotropins. So FSH is a gonadotropin. So if you think about superovulation, we have to give FSH. If they're more sensitive to FSH, then that means we don't have to administer as much FSH to a Bos indicus donor to get a superovulatory response. So that's kind of positive on the superovulation side. But the more we look into these differences, the more problematic they really become for the use of superovulation. So Bos indicus animals tend to be more difficult to detect in estrus. So the time period that they show estrus is shorter than Bos taurus. They tend to be more likely to show estrus at night when people aren't watching, or they have a lot more issues with just not showing estrus at all, even if they're actually in estrus. We can overcome some of that by doing timed artificial insemination within a superovulation protocol. But again, that's just another additional working through the chute on top of all of the other workings that are required for the superovulation protocol. Bos indicus animals tend to be more sensitive, in other words, get more stressed out by multiple handlings through the chute. So that's a negative for superovulation. GnRH-based protocols like the protocol that I showed you at the beginning of this talk are less effective in Bos indicus animals. And so a lot of work in South America, where most of the beef cattle are some sort of Bos indicus influenced breed, has focused on the use of using progesterone and estrogen, which works quite well, but neither of those products are approved for use in cattle in the United States. So that makes it harder to adapt the Bos taurus type protocols that have been developed in the US. So one interesting thing about Bos indicus compared to Bos taurus is something related to antral follicle counts. And Bos indicus animals have significantly greater antral follicle counts than Bos taurus animals. And so we'll talk about antral follicle counts in a second and how that relates to the production here. So overall, based on these kind of differences, you generally think that maybe OP-IVF is a better approach for Bos indicus animals. If we look at Bos taurus animals, because they don't have all of those issues, then they become less of a consideration. And the distinction between whether you use OP-IVF versus superovulation becomes more related to what your particular goal is. So this slide, I'm not going to spend a lot of time on it because it's not a great slide, but it basically gets to the point that OP-IVF works better in Bos indicus animals than in Bos taurus. So this is a study done in South America and Brazil. We have Neloi Bos indicus donors submitted to OP-IVF or superovulation and Simmental Bos taurus. And the main thing you can see, even though they didn't report for IVF what the mean number of embryos is, we know that they harvested about 15 oocytes and 41.5% of those became a transferable embryo. So they generated about 7 embryos from those Neloi donors. No FSH stimulation involved here. On the Simmental side, we have fewer oocytes collected, only about 8, and about 24% of those became blastocysts, so only about 2 embryos. So for whatever reason, the quality of oocytes recovered from Bos indicus donors seems to be slightly better, particularly if we're not using superstimulation or FSH stimulation in an IVF protocol. And that again makes IVF a better choice for embryo production for Bos indicus influenced donors. So what about antral follicle count? Antral follicles, what are they? So just some basic anatomy of the ovary here on the left-hand side. Essentially, the ovary of a cow has a lot of different kinds of follicles inside of it. And one of the types of follicles that it has is referred to an antral follicle. An antral follicle is just a follicle that has formed an antrum, which is just something that contains fluid within inside of it where the oocyte is. This image I showed earlier is from a cow that's been super stimulated with FSH. So the antrums of all these black spots, that's fluid in the follicle. That's the antrum of the follicle. So they're much larger because this cow has been stimulated with FSH. Normally they're small, but that's what we're talking about. All of these follicles that are on the ovary that have fluid in them, these are antral follicles. Well, what difference does it make what the antral follicle count is? So this is just looking at superovulation. And what we're comparing is Bos taurus study versus Bos indicus cross study. What you're going to see is that the authors of these studies classified donor animals based on antral follicle counts. So they used ultrasonography to go in and look at the ovaries, count the number of follicles on the ovary that were antral follicles. And they classified, for example, in this study, cows that had less than or equal 15 or greater than or equal to 25. In the bottom study, less than or equal to 10 and greater than or equal to 40. What you can see in both studies is that the cows that were classified as being in the high AFC category produce significantly more transferable embryos as compared to the low. And this difference is more pronounced within the Bos indicus breed. So that's for superovulation. If we look at these 3 sets of studies, which I don't really have time to go through all of them, it basically shows the same concept for OP-IVF. So if we just take one of them here, this middle one, which is Bos indicus influence, they're classifying cows as greater than 40 antral follicles or less than 10. If we look at the blastocysts that produce, again, significantly higher number of transferable embryos for the high group than the low. This makes sense because when we perform either procedure, When we perform ovum pickup, what we're doing is harvesting oocytes from the antral follicles. So the more antral follicles a cow has, the more oocytes we should have from that animal. That's the starting basis for embryo production. When we perform superovulation, when you give that FSH, what you're causing to be stimulated is antral follicles. There's a misconception among a lot of people that administering FSH creates new follicles or recruits new follicles. FSH only stimulates the antral follicles that are on the ovary. It doesn't recruit any additional follicles. So if a cow has a small number of antral follicles, doesn't matter if we give her twice the dose of FSH, it's only going to make those follicles get bigger because there's no other follicles there to respond to the FSH. So if you're talking about something that has a big impact on embryo production, it's selecting donors that have high antral follicle counts because they have more of the starting material that you need to have to produce embryos. So what about follicle stimulating hormone? In the data that I showed you previously, there was a tendency overall in the US data pool that there would be a benefit for giving FSH. Fortunately, the AETA doesn't break the data out by breed. It's just all beef cattle donors that were submitted to a procedure in 2020. So if we look at Bos taurus animals, there is some evidence that giving FSH will increase the efficiency of embryo production. Most of the effect is not on giving us more oocytes, but it's on those oocytes being more capable of becoming a transferable embryo. So the percentage of transferable embryos you get per oocyte is increased. But this depends on the individual donor animal because, as I mentioned at the outset, regardless of breed, there's huge variability between individual donor animals. On the Bossenicus side of things, again, we have different responses. And if you look at this data set from Brazil, basically what you're going to find, if you look across, you can't really read this, but wherever it says viable embryos, you compare FSH versus no FSH, regardless of the age of the donor, because they're basically comparing different ages of donors, FSH, no FSH, there's no difference. So on Bossenicus donors, there doesn't seem to be any advantage of giving FSH at all. So when you compare that to use of superovulation, along with all the other issues physiologically that Bossenicus animals have, it further solidifies that OPO-IVF is probably should be the preferred method for that particular class of animals. So something that's going to be talked about here later today is what effect the bull has. So a lot of people tend to overlook the impact that the bull has on embryo production, even though the bull is basically 50% of the equation. So a lot of people are like, oh boy, my donor just gave me 30 oocytes, I'm going to get a bunch of embryos. Well, not if the bull doesn't work very well, you're not. You got a good starting material, but the bull's got to fertilize those oocytes. The bull is going to contribute genes to the embryo that are going to have an impact on whether it continues to develop or not. So you can't forget the role that the bull plays in the process. And it's different depending on whether you're talking about superovulation versus IVF. Of course, during superovulation, you're performing artificial insemination. So the process that the sperm goes through is pretty similar. Doesn't mean that the bull doesn't have an impact, but you compare that to IVF, we're working with an artificial system. Normally, the process that sperm have to go to be able to fertilize an egg is a process called capacitation. When you perform AI or the bull does natural service, the sperm undergo capacitation as they go through the female reproductive tract and make their way to the ovary. Of course, in the IVF situation, we don't have a uterus, we have a petri dish. So capacitation has to be induced, and some bulls work well with this induction process and some bulls don't. So you always have to take into consideration how well a bull might or might not work in IVF. And the interesting thing is that there really isn't a very good correlation between how well a bull works in vivo, like in an AI situation, versus how well it works in vitro. So you can't say, well, I've used this bull for AI before and got really good conception rates. Why didn't it work in IVF? IVF is not the same as AI. So you can't compare them, it's apples and oranges. So one last thing I'll just hit on real quick that's becoming more of an issue, because as we implement more IVF, we tend to see that donor age might be going down. So what effect does the age of the donor have on embryo production? And so this again is a data set from Brazil. They're basically comparing different ages of donors. So we got prepubertal, peripubertal, and then heifers that have already reached puberty. And what you can see in this data set is that the number of viable embryos actually increases as age increases. So within the Bos indicus data set, there is an indication that younger animals are going to be less efficient at producing embryos than animals that have reached puberty. So if you're considering implementing OPU-IVF on prepubertal animals that are Bos indicus in particular, then you have to take that in consideration. So this is a really busy slide, but I just wanted to show you some data on the Bos taurus side. This is in Holsteins, and of course the dairy industry is really pushing the envelope on donor age, where a lot of companies are now using laparoscopic procedures that might be used in small ruminant animals to collect from young calves. And so the data set from the Bos taurus, specifically Holstein, so there isn't beef data from Bos taurus as far as I know, is that age mainly affects the responsiveness. So one difference in this study between the last is FSH stimulation. And the Bos indicus data set, none of those animals were stimulated. In this data set with Holstein, all of them are stimulated regardless of their age. So the younger animals are much more responsive to FSH stimulation. They have a lot more follicles, a lot more oocytes. Those oocytes are less capable of becoming embryos as compared to an animal or a donor animal that's reached puberty. So it's basically a wash in terms of the total number of viable embryos, because the younger animals, although they have lower embryo development rate, they have more oocytes recovered. But one caveat to keep in mind is that there's preliminary data that's not enough at this point to say one way or the other, that embryos produced from prepubertal animals also result in lower pregnancy rates after transfer. So it may not just be that there's a reduced embryo production rate, meaning lower viable embryos per oocyte, but even if they make it to the transferable embryo stage, those embryos might be less capable of establishing a pregnancy. So I think I'm basically out of time, Vitor. So I'm just going to stop there. And hopefully there's time for some questions.
Thank you, Dr. Block. Let's give him. We have time for one quick question.
Yes.
Yes, you evaluated the saving. It's kind of just a step up. At that time period, it can fluctuate better or worse throughout the year with nutrition, stress, things like that. My question is, how early can a donor be deemed, high atrial follicle count animals, and can that fluctuate in different time periods, like semen quality can, the presence of how many follicles given stress and nutrition to those other things?
Sure. So the question was related to antral follicle count, and basically how early in an animal's lifetime can you be able to predict whether an animal is going to be at high versus low. So there are fluctuations in antral follicle count during the estrus cycle, but those fluctuations won't change necessarily how you would classify an animal as either being high or low, because they're just kind of small fluctuations. And there's kind of conflicting data between Bos taurus and Bos indicus. On the Bos indicus side of things, the data that I showed, those studies with AFC and higher embryo numbers, those females were actually classified as either high or low in the prepubertal part of development. So they hadn't reached puberty. And by the time that they were collected after having reached puberty, they still fell within those classifications. The Bos taurus data is a little bit more conflicting and kind of suggests that it's better to wait until after they've reached puberty to classify them as high or low. And if you classify them in the prepubertal phase, it might not necessarily correlate well with what happens after puberty occurs.
All right, thank you very much, Jeremy. Let's give him a hand again. We kind of ate into our break a little bit, but it's fine. It's nice discussions, and I think that's sort of important here. We keep the conversation going. We are now, we're gonna have the two breakout sessions. So here, we're gonna have the genetics and fertility. And then we're gonna have the male impacts on pregnancy success on the smaller room. So while we're switching some of the PowerPoint presentations, I'll encourage you guys to, pick which session you guys want to do. Maybe grab a quick coffee, and then we'll meet back in here in 5 minutes. Thank you.